All right, let's get this started. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber, and I want to thank you for joining this week's Office, Field Services, and Manufacturing session. We again have weekly hours for you to hear updates, whether it's about your industry or all industries or Colorado or outbreaks. We have this opportunity for you to hear what you need to hear, answer your questions, and provide feedback. We also have a Thursday session that Jesse will show you later that offers the opportunity for you to do live question and answer. It's more of a limited number and it's not recorded. So please go to the link that will be provided later to sign up for that and be able to ask your questions live. I want to thank all of you for attending. I want to thank Boulder County Public Health for continuing to offer these times. We tabulated it earlier. I think this is hour 62 of these webinar offerings for industries for you to be able to get the information you need. It is important as a community that we continue to follow safe practices so we don't go backwards at any time. At this time, I'm going to pass it off to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. So I'm just going to start out, give you a quick overview of the situation we find ourselves in, some resources to support businesses and the community, and then we'll jump into sector-specific information after that. So first up, let's just look at the timeline. So we are chugging along through June, and last night and this morning, the state released draft guidance for camps, indoor and as well as indoor and outdoor events, and for their future Protect Our Neighbors framework. And those are draft, and I'll get more into the detail on those, but this is, this is the first big step since the June 6th clarification and the 6th public health order that came out, 6th revision to the public health order. And why are we again going through this phased approach? And that's really how Safer at Home was meant to work. It will evolve, and it is evolving, and it's not going to go away. And I'll get into what I mean by that in a little bit. But really where we are is until there's a vaccine, until there's a successful treatment, or until we reach herd immunity as a global population, we're going to be in a situation where we're trying to protect our communities with various measures. And it will be months until we reach that stage. And why is that? And it's because COVID-19 is just as contagious as it was in January, February, and March, and under stay at home. And so that's why we're continuing to trumpet stay at home as much as possible. Social distancing, wearing masks, those are the best ways to keep yourself safe. And this is, I sort of dropped this into this presentation here, and it comes up again later. Please encourage employees to stay home if they are experiencing any symptoms. We've heard complaints from employers and employees about employees having to go to work while exhibiting symptoms, and it's just not safe for anybody, and it puts the employee at risk, it puts your business at risk, puts the community at risk. So really try to protect the health and welfare of your employees. And if you have additional questions about compliance, please contact an attorney. We can help so far, but at a certain point, you're asking very granular questions that are better answered by someone who can represent you directly. And I know that some people don't have access to an attorney, and I encourage you to contact the county and the Boulder Chamber and other sources who might be able to direct you to services that can provide you with some legal guidance. Face coverings, I mentioned it before, but face coverings are really important. If you cannot maintain 6 feet of distance outside, or if you are inside a public serving building, you need to be wearing a mask. And the county and the chamber produce these great charts that are available on our website for employees and patrons that show when and what type of mask you need to be wearing at any time. And also for businesses, particularly back more than a month ago, we created a face covering script that was pretty basic, that basically just showed you an example conversation with someone who might not want to wear a face mask. We heard you, and there was a lot of concern, like this is a little too binary, a little too basic. And so our team went back and put together a much more comprehensive face covering script that really gets at the question of the person who's doesn't want to wear a face covering. How else can they get service? Do they have rights to use your spaces, the spaces you're operating without a face covering? The script really goes into detail on that, and I really encourage you to take a look at that. Now I'm going to jump to a little bit of information about outbreaks. In the past, we've basically talked about how to report an outbreak, and unfortunately, we've seen a pretty big surge in outbreaks for a community the size of Boulder County. We've had 3 confirmed active outbreaks right now. We have 3 suspect clusters that we're pursuing. Our epidemiological team confirms 2 resolved outbreaks. And as of now, or this morning, I guess I should say, there have been 45 workplaces that have been assessed within the last 6 weeks. So this plays into some information that I'll get into in a little bit, but I just wanted to remind you, again, the key is reducing these chances of workplace outbreaks by conducting those daily health checks that are required for almost every industry. Conducting a hazard assessment, really look at your business model and try and find the spots in your workflow that that have increased hazard, and see if there's a way to address those. We have a lot of resources on our website, as does the state, to try and address some of those hazard spots. And then again, cloth face coverings and social distancing, spreading out, making space between you and your customers, you and your employees, is really key. Finally, improving building ventilation is really important. And that can be as easy as opening windows. If you have the ability to open windows, that improves ventilation significantly. If you don't own the building and you need to work with a landlord, talk with your landlord about whether the ventilation system has been serviced regularly and recently, and whether there's a way to increase the amount of fresh air being pushed through the ventilation system. Those are all good ways to improve ventilation. And finally, report any confirmed COVID cases to Boulder County Public Health. Our epidemiological team will follow up with your sick employees, and we will follow up with you to see if we can figure out a way to allow you to continue to work, stay open while hammering some of those important details about keeping your space clean. This just goes over that link provides the best way to get to information about outbreaks, as well as the reporting form that you would need to do if you had 2 or more employees who were confirmed or suspected of having COVID-19. And COVID-19 symptoms may include all of these things, and they've expanded the list to include a lot of new things that they're discovering are impacting COVID-19 patients, such as a loss of taste or smell. And the state provides a symptom tracker, which you can use in your business to track your employees over time, and also provides a video and sort of a description on how to conduct those facility health screenings for employees. Where to go for general information? Here's all, these are all sources of information that you can go to sort of follow what's happening at the moment. The state's website is probably, it sometimes lags on updates, but it's also the place where they're going to push information first. We follow up. We have some very Boulder County specific information like our face covering guidance and our and that face covering script as well. And here are some other places you can go for specific information about your community, your industry, or if you have if you're looking for information about specific equipment, if you're looking for sources for that specific equipment, Manufacturer's Edge and EnergizeColorado.com are two really great sources for that. So variances, this is something that we introduced last week, and there was a push to get to this level of being able to pursue a variance. And I want a little bit of detail about that. The county applies for variances, not individual businesses, and we don't apply on behalf of individual businesses. We are taking your comments, and that's what that link there, the submitting guidance. We want to hear what you are looking for from a variance, so that when we get to the point of writing a variance, we can do that quickly. And why do I say when we get to the point of? That's because we talked about those outbreaks. You can't apply for a variance from the state public health order unless you meet certain caseload criteria, and that is the number of new cases and the rate of hospitalization. Those sorts of figures need to be at or below a threshold for the state to accept a variance, and we are no longer there. So what we are doing with the guidance is we're accepting information in hopes that when we reach that variance level, we'll be able to push out a variance and get it approved. But that chance of getting a variance, we really want to pursue that if we can, but it's going to take the entire community working together to really reduce the spread of COVID-19 in the county. I'm going to just sort of the big things that came out on Monday night. The state is pushed out new draft guidance on residential camps, indoor events, and outdoor events. And they're asking for our feedback and your feedback in particular. And you have to submit it by tomorrow at 5 p.m. And so Corinne is going to send out an email with these links, but the draft guidance is here for all of these industries, and then the feedback link as well. So please submit feedback, and we are hoping that, and they are hoping that once the feedback is in, they're going to be able to turn that around and release that draft guidance as official guidance before the end of the week is their goal. I do want to go back one second. Protect your neighbor, or protect our neighbors, was also announced yesterday, and it's really the next evolution of Safer at Home. The interesting thing is, like a variance, it also has a threshold that the community has to meet. So the county would have to qualify to move to protect your neighbors, or protect our neighbors. It is different from this new draft guidance. So the new draft guidance is part of the existing Safer at Home framework. What the state is looking at is what's the next iteration, evolution of our public health orders. And that feedback, and Corinne will have a link for that in the email as well, is due Thursday, I believe also at 5 p.m. So with that, I will hand it off. Thank you so much.
Hi, my name's Lalo Shash. I'm with Boulder County Public Health. I'm one of the office and events liaisons for economic vitality moving forward. So with the new information that came out, not really any new updates regarding office, the workplace. Things have stayed pretty consistent there. There was some new language that had come out last week regarding, some symptoms that came up I believe Jesse already mentioned some of these, but they were, if any employee is showing signs of, sickness, fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle, body aches, new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, diarrhea. And this is not even all inclusive, but these are some of the symptoms that could be COVID-19 related. With that, I'm just going to go over some of the general guidelines if you haven't had a chance to look at the state's website in the last Sixth Amendment of the Safer at Home order. Of course, it's 50% max capacity. That hasn't changed. That's based off of building occupancy, posted building occupancy. So whatever it says that the total occupancy limit is posted in your place of work, it would be 50% of that. But of course, along with that, please make sure that you ensure a minimum of 6 feet of space between all desks and workspaces. Consider modifying the flow of people, traffic to minimize contacts. You have certain doors for entry, others for exit only. You can, of course, so that goes with good signage. Reminders to staff. Encourage frequent breaks for hand washing in order to, of course, for sanitizing, cleaning. For most industries, it is required to do temp checks, and we do have some checklists online. Jesse did share the CDPHE symptom tracker from CDPHE. And if you have any questions regarding that, please, consult with your medical physician as well. Let's see here. Another thing you can do is have a coordinator for your work, someone who's in charge of reminding staff, who's really taking charge there, trying to guide staff in order to safely social distance. And this is all going back to building employee confidence. The more that we can do that, the more employees are going to feel safer returning to work. We have received some, complaints about, some employees of, having issues with their employers about returning to work and not feeling safe. We are only here to deal with it from a public health standpoint. But some of the complaints that have, come in, you can, again, by building employee confidence, post your cleaning log, put that out there. Make sure to clean high touch surfaces like the printer, light switches, doorknobs, things like that to build employee confidence. Jesse also touched on, fresh air. If there's any way to bring in, fresh air, that would help as well. And just try to, reduce congregation in certain areas, staggering shifts, breaks, alternate work schedules, and of course, encouraging telecommuting as much as possible. So again, that 50% max capacity, that does apply to every office, according to the posted occupancy limits. Homemade masks are okay. That is acceptable. As far as different sectors, if your office has manufacturing, retail, you would have to follow the guidelines for those specific sectors. So there can be different guidelines within the same building divided by sector. And, we have had this where some people are unsure whether it's allergies or COVID-19. As you can see, that list of symptoms that we had shown, some of those could be confused for allergies or COVID-19. And really the only way to know would be to get a test and consult with a medical professional. So if you are insured, please encourage your employees to stay home and follow the state's guidance with that symptom tracker too. It has a lot of good information there as well. Okay, then I'll pass it off. Thank you.
Great, thanks, Lalo. So field services and manufacturing updates. For field services, we did not have any updates at this time. And for manufacturing, there is a possible change on June 19th for non-critical manufacturing. And Alexandra will be covering that here in just a moment. Next slide, please. So just some common Q&A field service questions that we've had. So no open houses are allowed at this time. In-person real estate showings are permitted with COVID-19 measures in place. Occupied properties can be shown with COVID-19 measures in place. And then if employees are working outside or indoors by themselves, no face covering is required. So that were just some common questions that we had coming in. And then just some highlights for general rules. So no meetings, showings, appraisals, consultations, or gathering are 10 or more people. Gloves and mask face coverings required for any in-person interactions or work being done by third party in homes or office spaces. So say like house cleaning or commercial cleaning, that would be applied there. Maintain 6-foot distancing from all employees and customers. Sanitize high-touch surfaces, tools, and equipment, especially shared equipment, anything that is being shared between employees. And then assign a COVID coordinator to facilitate plan and communication and develop a plan for resources and implement procedures to monitor for symptom and health checks. Next slide, please. And then I'll turn it over to Alexandra for manufacturing.
Thanks, Ambra. So there's two orders or two guidelines. One is for all manufacturing, and that is for all businesses. The only and then the face covering as well. There's face covering for all manufacturing, critical and non-critical. And many of it is what you've already heard, the deputize a coordinator to address COVID-19 issues. One thing that came up recently is that the deputized coordinator was someone who worked in the office and was giving the information to the manufacturing facility. But she decided a good way to do that would also to deputize someone who worked on the floor of the manufacturing and also spoke the language that was spoken on the floor. So if there were Spanish speakers there, that information could get to them. And that also goes to transparency and being able to explain things better to your employees. Eliminate all the high touch areas or sanitize them regularly. Provide flexible or remote scheduling for employees that don't need to be there on a specific time. And then the symptom check is either at the entrance or if not possible at home, to be recorded electronically or on paper. So that's a general rules for both manufacturing. And next slide. And this is just for non-critical manufacturing, but good for critical too. Good idea. So right now, today, and for the next couple of days until we hear differently, it's 10 people per room with 6-foot distancing. A room has a door and wands. There's a draft out right now from the governor's office that starting June 18th, the non-critical manufacturing can have 50% of the capacity or up to 50 people, whatever's fewer in that room, of course, but still maintaining 6-foot distancing. So there's that draft out again. It could happen June 18th. It will be on the on the state site. And then of course we would be sending out information too. So watch for that possibly happening on June 18th. That would be able to increase the number of workers that you have in a non-critical manufacturing environment. But you still would have to maintain that 6-foot distancing. Another thing for non-critical, that one-way flow of work and people. So a designated door for in and then another door for out. Think about how, if you're going to have a face-to-face meeting, how are you going to group up in the hallway? No, you're going to create like a flow. So you'll use 2 different doors, so that one-way flow, so you're not passing as many people. Daily disinfecting and full cleaning in between shifts is an important thing. And use impermeable barriers such as plexiglass or something whenever possible to further separate the workers. So take it away.
So this is how to contact us by email at covidbiz@bouldercounty.org or calling the call center. I will say that the call center, it goes through the call center and then comes to us as a line on a spreadsheet, whereas an email comes directly to us. So, whatever you're most comfortable with, it will get to us. Email sometimes is a bit more direct. And I just want to remind everyone that today, Tuesdays, this session is part of our full afternoon of webinars. If your business happens to cross sectors, or you're interested in how other sectors are dealing with COVID-19 and dealing with the requirements of the public health order, these sessions are really good. I guess that's tooting my own horn, or our own horn, but they're really good. There's a lot of information. We've got experts who are right here to answer your questions, and Corinne keeping us all in line. On Wednesdays at 6 p.m., the Spanish language session is a co-sponsorship between the Latino Chamber and the Boulder Chamber. And again, we'll have public health folks there to answer questions. They're subject-specific sessions. And then finally, Thursdays at 1, we have a general session that's unrecorded, and it's really just a chance for everyone to ask questions. It's live question and answer. Corinne and I will be there, and possibly a rotating slate of other people. But we're there to answer questions, and if we don't have an answer, that's a place where you can ask a question and we'll do research and get back to you. With that, I think we're ready for Q&A. Thanks so much.
All right, so Jesse, this is for you. Is there any clear indication as to the cause of the new outbreaks?
I can't, I don't know. I don't know. It depends on each specific outbreak. And I know our epidemiological team is looking into trying to figure that out so that they can reach out to those, whether it be group of people or through contact tracing, they're going to find those folks that are affected. But I don't know in those 3 specific cases what the cause was.
We recently received emails. I know CU sent out an email saying that they've, current convening of students was tied, may have led to 1. I've gotten emails from, I've gotten the alerts that if you attended one of the peaceful protests on this certain date, there were individuals who had exhibited symptoms, so to self-isolate. So there have been some alerts gone out via social media or others about, but the key there is that our numbers are going back up slightly, and that we no longer qualify in some cases for the variance, which leads me to my next question. There's a question as to whether Boulder County will meet the requirements to shift to protect our neighbor or protect our neighbors in July.
Well, we have to work at it. It's going to take reducing the new caseload rate, reducing the hospitalization rate. Those are the sorts of figures that the state is looking at to see if we'll qualify. That's what this session is about. That's what our outreach to the community is about. It's about, here are the ways that we are going to get back to keeping our numbers low, to sort of use a broad term for it, I guess. But I mean, if you think about it, a week ago, we were, as a community, seeing slowing infection rates. We were seeing a successful combating of the virus spread, but a couple small events changed that significantly. So I think it's really just a good reminder that social distancing, wearing your mask, staying at home, limiting group sizes, those sorts of things they're very simple. It can be very frustrating, but they are the best way for us to limit the spread and keep our community safe and qualify for these future events. I mean, it's sort of funny that in my mind that we're working so hard to qualify for another program that's going to tell us what to do and what not to do. But I think that's really where we are. The best way to combat this is to work as a community to try to minimize that spread.
And it's trends, it's over time. And right now we're just now getting numbers for people that were potentially exposed 2 weeks ago.
Yep.
So, you know, July 1st is in 2 weeks. So those, you know, we need solid couple weeks of trends in a positive direction. And then we also need to realize there's a lapse in that time frame. So the education we're doing right now will affect 2 weeks from now, but we'll need to have that trend over time.
And I think, I mean, now I guess I'm sounding a little doom and gloom that, you know, it's not just will we get to move to protect our neighbors. It's if we continue to see increases across the community, across the state, we can go back to stay at home. You know, that's the governor and public health officials have made it clear that we have to see positive trends in order to show that we are capable of opening up more.
And we've seen some recent not successful stories in some of our neighboring states and across the nation. And some states aren't even open yet. I just talked to somebody in Portland yesterday. They're still in stay at home in a lot of areas. So we don't want to be the Arizona, Florida, Utah, Georgia, North Carolina. We don't want to be that story because they're heading in the wrong direction.
Yep.
So this leads to someone who submitted that all the research they've seen from WHO, National Institute of Health, ASHRAE, which happens to be the HVAC, the Association for Heating, Refrigeration, and Air Conditioning Engineers, OSHA, that offices and buildings are dangerous because of because of airflow and issues there. I guess they made a comment that they feel that offices are a dangerous place, but you know, what are some of those key things that you need to keep in mind when you're looking to open offices, on that airflow, on the HVAC, on your facility, to make sure that it's, as he put it, you're in a coffin in a way in an office.
Lalo, do you want to give that a shot?
Sure. I could say some of that. I think that you spoke to some of that as well, Jesse. But you know, the order just says that, you know, the HVAC system has to be up to OSHA standards. Doesn't really lay out super specifics there in the order. But as far as that goes, one thing that you had mentioned is, you know, servicing the HVAC system. You know, speak with the landlord, see when it was serviced, make sure that it indeed is clean, that there's you know, that they're changing the air filters, make sure that the filter that's on your HVAC system is actually the one that's made for that make and model as well. I mean, and this was mentioned over and over again, if you can, you know, bring in that fresh air and not rely so heavily on air conditioning, solely on air conditioning. But if you have the ability to bring in that fresh air, and you know, if opening windows is an option, of course, the more fresh air, the better. You know, you can also encourage, you know, vulnerable employees to stay home, encourage telecommuting as much as possible. You can encourage a rotating work schedule, alternating work schedule as well. Try to reduce congregation. One complaint that we get is that the masks that are being provided by their employer are just maybe not up to standard, or the employees have questions about it. So if it is possible as an employer to provide your employees with, you know, real high grade, high quality masks, that would instill some employee confidence as well. So again, especially during these summer months while it's warmer, if it's possible to bring in, some fresh air, that would be, recommended. But other than that, we are just following the state's guidance that continues to evolve and continues to come out. For specifics, of course, consult, with a medical professional or an attorney.
Well, and one of the question is there a lot of legal risk in bringing people back or opening businesses? And one of the links that I provide in our email is a link to a webinar the Boulder Chamber put on about the legal liability, legal insurance, and HR liability of reopening, and talked a little bit about, what the standard of care is right now. And the best advice that the lawyer on that gave was make sure you're following the strictest of the public health orders, because this cases haven't been even tried yet. And that is the standard of care that's coming out right now. Make sure that masks are being worn. Make sure that if someone is sick, they stay home. And that's why you brought up, like, if there's an uncertainty of allergy or COVID, stay home. So bring, that confidence and so forth. So I will continue to provide that link. It is a fascinating webinar about that liability risk. And again, always talk to a lawyer about interpreting the rules, as Jesse put earlier. We have a question about if there are any emerging guidelines or standards for sanitizing and disinfecting.
Yeah, so as far as emerging, I know that there are guidelines on CDPHE. I'll be happy to paste the link there if needed, but this goes into a lot of detail there. It's covid19.colorado.gov/cleaning -guidance. So I'll just go ahead and copy paste this, but this has a lot of information depending on whether it's a household, a workplace, a vehicle, a regulated facility, how to clean and disinfect. It is pretty lengthy, but this has a lot of great information. If you definitely want this guidance on how I don't know how emerging it is, but this guidance, I believe, has been there for a little bit. So I'll just go ahead and share that as well.
And some of that talks about, the parts bleach to parts water that you need to do if you're creating some of your own solutions. And we've heard from a lot of offices saying, we clean our office once a week. That's our normal rotation, manufacturing facilities, so forth. Should we increase that? And that is a question we get a lot. Should they increase the amount of times they clean in the office?
Yes.
Again, I would say absolutely, especially if you want to instill that employee confidence and, you want your employees to feel comfortable coming back to work. If you just did it once a week, consider doing it, more frequently, but, post your logs, especially those high touch areas. Avoid any kind of congregation. If your employees see that you're taking it seriously, then they will be more confident to be able to come back to a safer work environment. But again, yes, of course, increase cleaning, provide, sanitizing wipes if you can, or hand sanitizer, whatever you can do to make it a safer environment for your workers.
Thank you. So this may go towards Jesse, or if any of you can answer this. Are there any variances or guidance yet for cultural organizations, museums, library, and so forth?
There has not been any specific guidance for those sorts of institutions, museums, galleries, that sort of thing. But again, I think, what you're going to be looking at is probably the event guidance. But no, I have not seen anything. Alexandra, Ambra, Lalo, have you seen anything specific about museums or cultural institutions?
I think I did read something that they're reviewing for museums and galleries, and that should probably be coming out soon.
Okay.
Yeah, no, I have not seen anything pertaining to that specifically.
But again, sometimes you find out the day the governor announces it in a press conference. So, you know, as soon as we get information on that, we try to send it out as much as possible.
Yep.
And as quickly as possible if there's new guidance or new draft guidance to give input on. I think that's the key. We have learned through several other industries that the state does use the feedback they get on those draft guidances. So there are opportunities for you to give feedback, give it. You know, we've seen changes in restaurant, we saw changes in gyms based on the actual conditions of the businesses, because that's hard for all of us to know. So make sure that when I send out those links to give feedback on the protect our neighbors space, do it, because it is important to collect that information. We have a question about elevators. You know, that is a common area. Elevators are, you know, kind of enclosed place with there's negative air pressure. Any specific area focus on elevators, or should people take stairs? What should you be thinking about with your elevators?
You know, again, I have not seen specific information about elevators. Cleaning, that's obviously an area where you're going to want to clean regularly. And I would say, you know, if you're more comfortable taking the stairs, take the stairs. But elevators are a great, you know, are a way for people who may be challenged in their mobility, they can get to places. So we want to maintain that service.
Well, in hospitality, so this came up with hotels, and there was the, you know, making sure you're not packing your elevator,
Yeah.
that the cleaning happens, there's social distancing happening on the elevators as well. And to think about that as a space where, you know, you're going to have people in a confined space for a short amount of time. So masks should definitely be worn and things like that.
That's the key, right? Mask, if you can't maintain the social distancing of 6 feet, have a mask on.
Okay. So wait. I don't have any other questions in the Q&A and the chat feature. I know that there's a lot of, you know, there's concern out there from employees and employers about when's the right time to come back. You know, how do we prevent, how do we know that our facility is safe? How do we prevent liability issues? So those are continual conversations. We have other resources. We'll point you to resources and continue to ask questions. I mean, you want to make it as safe a facility as you possibly can. Do any of you have any final pieces that you'd like to add before we close this one off?
Okay. Thank you, everybody. Thank you.
Actually, I have one more question that came in for later.
All right.
So you said it's 50% of the posted occupancy rates. So
Yes.
what if you are a facility or a building and your occupancy rates include your meeting rooms where you can have 90 people in your meeting room? Does that mean you can bring back most of your staff because you're 50% of your full occupancy, or should you really be trying to make sure you continue to have less staff in the office, even if your occupancy rate's much higher?
You could correct me on this if you'd like, Jesse, but I would go with the more stringent guidelines and just try to, you know, it's 50% max, but really try to keep that, you know, below that if possible. There are a lot of good questions here. Again, we don't make up the guidelines. We're just trying to pass along information that's been shared with CDPHE. But if you have any concerns, again, you know, CDPHE, Colorado Department of Public Health and Environment, they are the ones that are really coming up with these guidelines. We are doing our best to share this information with the public.
Okay. So if your 50% is maybe higher because you have these large meeting rooms, you still want to make sure that you have, you know, distancing between your employees and that you're trying to keep you're trying to minimize the number of people in the office at the same time.
And
So,
I would say it's 50% of the office space that doesn't include the 90-person conference. I think that's the easy way to think about it.
Mhm.
okay.
I think your conference room
That's
bumping up.
Much
your-
better way to think about it. Thank you. Just because occupancies vary across the board. All right,
Exactly.
now I'll let you guys go. So I want to thank you again for joining us today. I know we have a lot of information. Hopefully we'll have more information next week. Continue to ask your questions. The answers aren't provided. There are always resources you can go to, and some of these answers haven't been answered yet, or these questions haven't been answered yet, because our society is still going through a lot of uncertainty and change. We will have these weekly. If you want to do live Q&A, we have that on Thursdays, and we'll see you next week.
Thanks,
Thanks,
Corinne.
everybody.
Thanks,
Thank
Oliver
you.
and Amber and Laura.